Hello everybody, I'm Dr. Burness, and I run a concussion-focused functional neurology and chiropractic practice in Oakville, Ontario. And I thought this morning I would take some time to answer a question I hear from most of my patients, usually towards the end of their treatment when they're starting to feel a whole lot better. They'll often ask me, when can I go back to doing whatever activity it was that they got injured doing? And usually that's some kind of a sport or a physical activity. And when a patient asks me that question, what they're really asking is when is it safe for me to get another concussion? And of course, the answer to that question is that it's never safe to get another concussion, but there might be a risk-benefit ratio here that needs to be considered, right? So in order to consider that and to have clarity on the decision of whether you should go back, I think it's important to understand exactly what a concussion is, what the injury was. You get a diagnosis of a concussion from a medical doctor or whoever it happens to be, or the word concussion is pretty vague. It doesn't tell you exactly what area of the brain has been injured. So we'll just get into that just a little bit. So if looking at a brain, for example, this is just a diffusion tensor image, but it just shows the major pathways from different areas of the brain, and we can see that it looks pretty fibrous, and that's really what's happening here. Is all the different parts of the brain are connected by nerve fibers, which are extensions of each of the cells of the nervous system in the brain. And these different areas of the brain which work together have to communicate through these pathways. And so if we look at this diagram here, this is just a simplification of a pathway from, say, part A of the brain to part B of the brain. And the connection is made of neurological cells. So if we just say each of these green arrows here in circles are nerve cells that are connecting part A to part B of the brain. So it's a physical pathway, and when we have a brain injury, when we have a concussion, essentially what happens is this: we break some of this pathway, and then whatever communication that was going between part A and part B is diminished, so the function of part B diminishes as well, and maybe part B here is balance, or part B is the ability of you to hold your eyes on target, or maybe it's autonomic control, so you're having light sensitivity and sound sensitivity, or nausea, or heart racing, or whatever it is. But the point is that this part B here is no longer functioning correctly and can be generating symptoms. So, as a functional neurologist, what I do when a patient comes in with a concussion is I'm looking for this. I'm looking for what exactly has been diminished and what pathways have been injured. And then if I can find that and there's a remnant of the pathway left, then we can try and drive this pathway to increase function. And there's a property known as neuroplasticity, which I'm sure anybody who's watching this video has heard about. But basically what that means is that, if you drive any pathway in the brain, it becomes more efficient, and it becomes more efficient because the brain is actually laying down new connections between the cells involved in that pathway, making them more efficient. So we try and, when we're working with a patient, we're going to try and make this remnant more efficient so it can do the work of all the fibers that were originally connecting A to B. And if we're actually able to accomplish that, then the pathways will start to form, the connections will form, and you get some increase in the function of B. And of course, the ultimate goal is to have full function in that area of the brain again, or full functional capacity. The person has no more symptoms and is able to do the things that they want to do. So that's the goal. But if you look at this pathway, yes, you've got good function again. The symptoms might be gone. The person's feeling better. But, you never got these fibers back, and you just don't. Unfortunately, the brain doesn't replace neurological cells, at least as far as we know in most areas of the brain that doesn't happen. It just makes new connections, right? So you've never gained this back. And if you think about this pathway, if you think about it like a rope, right? It has a certain tensile strength, and this rope has been cut 2/3 of the way through. And again, this is a simplification, but this is what's happened. So now, yes, we have good function, but we don't have great structural integrity here. If we put a big pull on this rope again, there's an even bigger chance it's going to tear because it's already fragile in the first place. So there's a bit of a risk involved with putting another stress on this pathway, and you know, how much you're willing to accept that risk depends on, what's at the end of this pathway, right? So for most people, the average person that I see, maybe their ability to do their job is dependent on that function, or maybe to drive a car or be out socially with their friends, things like that are at the end of this pathway, and they might not be willing to take the risk of further damaging this pathway and losing those activities. But if you're a professional athlete, then there might be millions of dollars at the end of this pathway and the rest of your working career if you're a young man or a young woman. So yeah, there's risk benefit ratios that have to be considered here, and I will never make that call for a patient. They have to make that call. They're the one that's assuming the risk, and no doctor can tell you for sure that you're not going to get another concussion if you engage in that activity. And certainly some things are more dangerous than others, and maybe you can dial it back a little bit and not take the risks that you were taking before. If it's something like skiing, maybe you're not doing the big jumps or running the double black diamonds or whatever they are, and you're easing up so you can still enjoy that activity. But again, that decision is always up to the patient, and you have to realize if you've had previous concussions, and especially if you've had PCS, there's a real good chance you hit your head again, it's going to be worse next time and may drag on longer, and possibly not even be able to be repaired at all. So keep that in mind as you're going through the process yourself. If you are feeling better, you're not 100% structurally. You're certainly maybe 100% functionally, but you're not usually up for another injury in the same area of the brain. So I hope that's helpful. Thanks for watching.